So I'm a child health scientist, and I completed my training in physical therapy, clinical epidemiology, and then a PhD in medical sciences at the University of Toronto. From there, I worked as a scientist at the Hospital for Sick Children Research Institute for many years, and I continue to be affiliated with them as we have a shared interest in children's health. I was recruited to Laurentian to fill a Canada Research Chair position in 2005. And part of that was to support the development of a new interdisciplinary PhD program in rural and northern health. And that was a very exciting opportunity for me. As a scientist, I continue to maintain the same objectives, which are to improve the health of children through research. And part of this is ensuring that children are actively engaged and their voices heard through research, so that the results can be used to guide clinical practice related to child health. Research career and my focus on children's health came before I started my master's training. I was working at the Hospital for Sick Children clinically, and one of my jobs was working with kids who were undergoing major limb reconstruction surgery. And one of the questions that I had was, is this a good thing for them? Because what they went through was quite involved technically, was quite painful, led to more similar leg lengths when they were finished, but I wasn't sure that overall this was a good thing from the perspectives of the child, and nobody was really listening to the child because we didn't really have a good way to engage the child. And so it was at that point that I started to try and figure out, how can we create a method that will allow us to capture children's perspectives in a way that is within the cognitive reach of a child, so they're able to answer the questions, but that generates something that the clinicians and the researchers could understand and would listen to. And so putting their feelings into numbers was sort of the essence of where this started. And being able to bring voice to a couple of kids who were undergoing quite significant surgery was the impetus for what turned into a career in child health research. I started my career working in child health measurement, and I was one of the first authors in the late 90s to establish children as being able to report on their own health. Prior to that, it was largely based on physician ratings of children's health rather than what children thought internally. Because health and well-being is something that is a very personal judgment, it made sense to involve the children. My research over the years has been funded by a variety of agencies, including the CIHR and more recently IHRDP. From there, my research has evolved into looking at how we adapt measures for other cultures and other contexts. And I've had great international experience working with countries in Europe, South America, Asia, looking at how to adapt measures so they can be used with children in those countries. And it's not always a simple translation of the language, because certainly translators don't speak the same language that children speak. So there's a cultural and an age adaptation that has to be made, and often the clinical environment is very different in those countries. The experience has been really rewarding. The collaborators and colleagues I've had internationally has been tremendous. Right now I'm one of the Canadian leaders on a project in Brazil, as well as a project in China, working with Beijing Children's Hospital. And there's always great relationships built, and it's wonderful working with the children. Connections are built even though we don't speak the same language. In addition to lots of discussions with the children, we've also had lots of discussion with the elders in the community and the health service providers in the community. And they're very excited to take this measure, implement it on a community level, assess all of their children's health, and use that information to decide what services they deliver, for whom, and when they deliver it, and it will also allow them to determine if the services are effective. So something that we've always used in mainstream Canada, which is called evidence-based medicine, now has the potential to be implemented in an on-reserve context. So one of the most exciting things that's happened recently is that we have approved a new research center at Laurentian University called Evaluating Children's Health Outcomes, or ECHO for short. And this was really a collaboration of a number of fabulous faculty at Laurentian who share a common interest in child health research. So the child health research that's going on at Laurentian isn't just me. There's a group of 8 faculty, and it's actually growing, who come together to share ideas, to share resources, to grow the child health research that's happening at Laurentian University. And that's a really important prospect for us, and particularly for our Aboriginal partners, because a large proportion of the Aboriginal population are children. We're very interested in children because they are the next generation.